Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR
What's
specialty.
going on with both of your shoulders?
Well, I had total replacements on both shoulders.
Both shoulders, okay.
Yes,
When did
and-
you have that?
07 and 08.
07 and 08. And what happened after that? What kind of treatment you had after that?
Well, I had a bit of physical therapy right after the surgery.
Sure.
I was doing a lot better than I can do today.
Okay,
So
that's good.
I like to see some improvement. And I used to wake up before the surgery. I'd wake up crying, because of
Okay.
the pain.
Okay.
And so that went away. But now I'm having trouble sleeping. It wakes
Okay.
me up
So
several
what
times
the
a night.
current symptoms you have? Trouble
Waking-
sleeping. What else is difficult for you to do?
Well, just lifting or taking care of myself, taking care of my hair, reaching parts of my body I can't. I can't get down on my knees at all, but that's to do with
That's what
my
we're gonna do,
fake
work
knees.
on
Yeah.
that for the knee.
Okay. So, otherwise, I have trouble with stairs. I don't do stairs. I
What
don't
about the
pull
shoulders?
myself up at all.
Oh,
with
holding the
anything.
rails.
If I fall down,
Yep.
I have to get somebody to help me and lift me from here because they can't pull my shoulders.
Your
They
shoulders.
can't lift me up with my hands.
Because the pain or what tightness?
Well, because
why?
of that 5-pound weight limit I have on my shoulders.
5-pound weight limit.
There's
for
no
both
way
of
I
them.
can let anybody
Oh, okay.
pull me
Pull-
up.
yeah,
So
that's not
I
safe,
had
yeah.
and I had to wait for an ambulance
Oh,
to
sorry
get me
about
up
that.
before.
Yeah. So how long do you have limitation in your shoulders lately, like after the surgery? Because
After the surgery, well, it was 30 days in a sling. You can't move.
no,
you
I
know.
mean like currently. Let me see your range of motion and tell me how long this limitation.
Oh,
How long it's been limit like this
is this before my surgery or after?
after the surgery?
After the surgery, it's been like this. I used to could reach up a lot higher.
Okay.
And I can lift up above my head, and I can't do that at all. I can
how
push
long?
up here.
How long you cannot do?
But-
for how long?
It's been probably 2 years.
2
good
years.
2 years
Can
now.
you do this?
Oh no, I can't. I can do my shoulders, but I can't get
You
my
cannot
hands.
reach you.
I can't get my hands behind my neck.
Okay, let's thumb up like this.
Yes,
and
I
bring
can
it
do
up.
this.
Up.
I can't do any.
Oh, that's as far as you can
As
do.
far without pain.
Without
That
how
was
much pain from 0 to 10?
There, I was about a 4 when I stopped.
4
Yeah.
out of 10.
Yeah.
And so this limitation been for the last 2 years.
Yes, more extreme the last
More
2 years.
extreme.
Yeah.
Did you have any other treatment in the last 2 years to
No,
get this?
3 years ago I did, but
Okay.
yeah.
Okay. So everything should not aggravate your symptoms. When you do this motion, where do you feel the tightness? In the back or the front?
Feels it right here in the front,
Both of
right
them?
in the front.
Okay, so let's lie on your back. We're gonna take the range of motion first, and then
Okay.
we'll do the treatment. So we're gonna do shoulder flexion. Okay. Up, and stop when you feel pain. Okay.
There.
That's painful. Okay. So you see the number? It's 113. 113. Okay. Let's go do this motion. That's a shoulder abduction.
Yeah, that's as far as it'll go.
That's as far as I can.
Ouch.
Wow, sorry. Okay. So it's almost like 88 abduction. Sorry.
Yeah.
How much pain with that?
That was more like 8, yeah.
8. This is the left because we're gonna do the right. Okay. All right. Oh, you're really tight here. So this motion is external rotation. Back here. Okay. And that is 50. See that? 50 here. Okay. Let's do it inward here. That's the internal rotation. And the range of motion for that is 65. Okay. Let's go to the other side. We'll do the same thing here. Okay. Lift your head up. So this is the right shoulder, okay? Up toward this. Is that as far as you can go?
Yes.
Okay, and this one is 90, 95 flexion. Okay, it's a lot of numbers in here. Okay, bring it this way.
That's it.
That's it?
Yeah, that's it.
Okay, so this one is... Sorry. That is 70? 70 abduction? You're really tight.
I know.
Yeah. And this we're gonna do the internal rotation. And that is 50. See that? 50? Okay. External rotation, back.
Okay.
And that is 65. External rotation 65. How much pain did you feel with all of that?
It went up to just about my limit. We were pushing 9 here. Yeah.
Okay, sorry about that. So, let me know if you feel any pain, okay?
Okay.
So I'm gonna work on it. And you tell me. So she has a total shoulder replacement. This is the place of the incision. So you had this limitation for 2 years. Your limitation
Yes, the
of
most recent. Yeah.
2 years.
Yeah,
Okay.
yeah.
Let me know if that's too much, okay?
No, that's okay. That doesn't hurt.
Okay. So can you give us like a little history why you had both shoulder replaced?
Yes. Well, what happened is I have a family disease. We get
Okay.
synovial chondrial osteophytes. Well, the joint just melted when he did that. My doctor did a full X-ray of both shoulders, and there was no joint. There was a hole
Oh wow.
where the joint was supposed to be.
Wow.
And so he said,
Genetically, yeah?
sent me to a specialist in Flagstaff, Arizona. I was living out by Kingman at the time. And so
Oh wow.
I went to Flagstaff and had Dr. Moisey replace both shoulders, but they were a year apart. And I had to agree to this 5-pound limit before he'd even do the surgery.
Yeah,
Because my osteoporosis is.
When did you have this shoulder surgeries? What year?
The right arm was done in 07 and the left arm was done in 08 in Flagstaff.
So we currently in 2018. It's not
Yeah.
2030, okay? Future. All right. Sorry.
Yeah.
Sorry, it's cold, okay?
Yeah,
I
it
forgot
is.
to tell you.
It's kind of shocking and
Sorry. It's gonna get warm from your skin, okay?
good.
Yeah.
I get these.
Lift your head up.
Fibrocysts I have.
All of this scar tissue, what you have here.
Is that
you
what
feel
they-
those bumps?
Yeah,
Sorry.
that's scar tissue.
That's scar tissue.
Oh,
So,
yeah.
did you have anyone work on the scar tissue?
No,
Before?
nobody's ever done anything
Oh,
about
okay.
scar tissue. I'm sure I have a lot of it.
Yeah.
Jeez.
So white scar tissue could be a problem because our muscle should act like a rubber band. When it contracts and relaxes, it does this.
Oh.
When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, it does not stretch. Does not matter how much stretch you're gonna do or exercises, it will never break the scar tissue. We have to manually break it. And those are the instrument I invented to break the scar tissue.
Oh, okay. Whoopee.
Yeah.
But that's good.
Yeah. So you feel all of that?
Yes.
Make sure it's not painful, okay?
It doesn't feel good, but it doesn't feel horrible.
Make sure
you
it's
know.
not painful, okay? Because there's fine line between breaking a scar tissue and causing scar tissue. We just want to break it.
Yeah, we don't want to cause any more.
No.
I had an external fix on my forearm because I broke this wrist and I fell down a flight of stairs, and so they put an external fix here and here, and I had to have 12 weeks. I had this big apparatus on there for 12 weeks. So if I have scar tissue, it's down there too.
Yeah, you get the scar tissue from accident, trauma, surgeries.
And I've broken
You know.
this bone here and
Man, when
some
did you do
bones
that?
in here. Well, because I have osteoporosis. I fall.
You fall a lot?
Let's see, this one I did in like 03, my wrist, and they had to operate. It was a mess. Never fly down a flight of stairs. It's
Do you have a stairs at home?
A what?
Do you have a stairs at home?
No. No.
Okay, yeah, make sure you don't have a
No,
stair. I
no,
hope not.
I said, no, I
Okay.
got a condo, but it's all on one level.
Okay, so let's bring this back.
Ah,
Wow.
that moved better. That moved better. Oh, gosh. I'm glad of that.
Did you notice that? Is
Yeah.
that your shoulder?
I'm amazed because I didn't hurt like it hurt when you did it before and we didn't go as far.
Yeah, this is treating the source of the problem, not the symptoms. Lift your head up.
That is great. Oh my gosh.
We're gonna do after the treatment measurements, okay?
Oh boy.
Relax, relax.
Okay.
Sorry. Okay. Need to do a couple of things. Let me know if it's painful, okay?
It's a little sore back there.
Sorry. Okay. All right. So let's clean this up first. Okay. So let's go over the left shoulder flexion. What the number was there?
It was 113 originally.
113. Okay. We're gonna take this now.
Okay.
Flexion. Up. Straight up.
Oh my gosh.
Okay.
Wow.
Oh, sorry. There you go. Okay, so that was 113. Now it's 155.
Wow.
Okay.
Wow.
Let's do the abduction this way. Okay, how much that was before? No, from the top. This was 88. It's 113. 130.
130. Wow.
Yeah. Okay.
Wow.
What about external rotation? Wanna come?
50.
External rotation was 50. Going this way. Okay. This is 65. 60, actually 66. Okay. Internal rotation, how much it was?
It was 65.
It was 65.
Yeah.
Okay. Internal rotation, that is 70. Oh, actually, it was 65.
Yeah.
Now it says 68. Okay, that's good, not bad. We can go to the other side. Right side, flexion,
Flexion was 95.
95. Lift your head up. Oh, we did not work on that side.
We didn't. Wait a minute.
Well, let's work on it first, okay?
Okay, good idea.
That's a good idea. Look what why the number did not change. Okay, you see?
Hey.
You guys are awake, okay? That was a test.
So one arm's the before right now, this one's the after.
Yeah. Sorry. Make
No,
sure
I
it's
understand.
not painful.
Not
So,
if
you
it's
had any treatment similar to this ever?
no, no, they never
Yeah.
did anything like this.
Yeah.
That's some kind of a machine that buzzed, vibrated,
Yeah,
a slight vibration, but
Yeah, it's not.
yeah.
So you got a lot of scar tissue here too, and I'm not surprised.
Well, yeah. It took a while for those surgeries,
Yeah.
He said,
So I'm gonna work on here on this side. The same thing like the other side. Sorry. Is that painful? It's okay. Pain?
cold, but it's uncomfortable, yeah.
Make sure it's not painful. Too much?
No, not what you're doing, what you did at first. I still feel some discomfort right in here.
Sorry.
Yeah.
So you fractured this too?
Nope,
No,
just my hand.
Just your hand?
I broke my hand a couple times there, yeah.
Oh,
But that's what happens when you have thin bones.
yeah, you break a lot of stuff.
Yeah. And I think I'm not going to fall anymore, but
You will need to.
I
We
fall.
need to work on your balance. We'll take
Yeah.
care of that. Yeah, sorry.
Yeah.
Is it painful what I'm doing here? or
well, I
it's okay?
felt it.
Yeah. You can see the total shoulder incision is here. They actually did a good job. It's really clean cut. Yeah, that's good.
He's a good surgeon.
Yeah, that's
He
good.
was at
Yeah.
Yale. He did a fellowship at Yale.
Nice, beautiful. Yeah.
So he is, and he works with the Olympic team.
Oh,
So
nice. Yeah.
nice. He takes old people in between,
Yeah.
So
You're not too old.
he takes us Medicare. I'm 78. Yeah, yeah. My mother, though, who just died last September, was
Oh, sorry
100.
about that.
She was 100 when she
Oh,
died.
nice. Because
So,
that's a
you know,
good-
when
yeah.
people say, oh, I'm sorry, I said, don't be sorry. She had a great life. You know?
Oh, yeah.
Yeah, my gosh, she got
good.
to travel and do all kinds of things.
That's
so.
beautiful. That's good.
And she was really smart.
Yeah, that's nice.
She, like my son, they have photographic minds.
Nice. Yeah.
I didn't have that. It skipped my generation.
Okay. Let me know if you feel any pain, okay?
There's a lot of
Scar
bumps.
tissue?
You know,
That's a scar
yeah.
tissue. Oh, a lot of
Yeah,
scar
there's
tissue.
a lot of
You have
that.
A lot of scar
Yeah.
tissue here. Yeah, I'm not surprised because you never had any treatment for scar tissue.
No, I never had.
Yeah,
Jeez.
yeah. Man, you feel that here?
I have a lot of scar tissue in here because I had a hysterectomy and a gallbladder
Wow.
surgery, and they left 2 pins in me when they did my gallbladder. I have 2
Oh,
surgical
boy.
clips in there.
They
And they're
forgot
there
it
to-
there?
Huh?
They forgot it there?
Yeah, they missed them, and it was back in the 70s,
man.
early 70s. So
That's sad.
I went to St. Joe's to have a
They
cataract
remove it after
surgery.
that?
It was at St. Joe's, yeah, that they did that. And they said, had I ever had surgery there? And I said, yes, I did. I had my gallbladder out, but you left a couple surgical clips. You wanted to take them out? They didn't want to.
Oh my God.
Yeah, they're still there. That was a concern when I had an MRI one time. They asked me if I had any metal in me, and I said, well, I do have a couple surgical clips. And they said, what? What? That could be like a bullet, you know, in reverse. But then it turned out they'd been there for 20 years, so they said, nah.
Okay, so let's see
Not
the
a
range of
problem.
motion. How's that?
Wow.
That's nice.
See, that doesn't even hurt, though.
Yeah, let me actually do a couple of things.
That is great.
Yeah.
That's
So-
amazing. Holy cow.
Yeah. So this is ASTR treatment, the instrument that I use on it. It's called ASTR.
ASTR treatment, huh?
Yeah, yeah.
Wow.
ASTR.
ASTER?
ASTR.
ASTR, okay. Thank you.
Sorry. Okay. So let me see. I'm gonna do a couple of things here. Make sure this is not painful. Okay.
No, that's not painful.
No pushing over.
Wow.
Oh, there's a music in the background. Okay, make it more entertaining.
What if it's copyright?
No, because we're recording now. Okay. Let me know if it's too much, okay?
No, just trying to relax.
Okay, there you go. All right.
Good.
So you feel that
Uh-huh.
band here?
Yeah.
So I'm gonna release that band.
What is that band? Is that scar tissue or?
That's a fascia restrictions, so I'm
Ah.
gonna release it. Fascia is like a wraps around the entire body. It's like a Spider-Man suit. That's one layer. There's
Oh.
other layer wrapping each muscle. When you have
Okay.
fascia restriction, it's like something squeezing like this.
Yeah.
Doesn't allow your muscle to contract properly.
Oh, wow.
So I'm releasing that.
That's great.
How does
deal.
feel?
Fine.
You remember
Feels
the band
better.
was there?
Yeah. Where'd it go?
It's in here.
Just wait. Thank you.
Magic.
That's great. Wow.
Okay, let's bring it back. Okay, and we'll take that range of motion. How much was flexion?
Flexion was 95.
95. That is 145. Okay.
Wow. And that didn't hurt, though, when it was
Yeah.
at its farthest point. It
Yeah.
didn't want to go farther, but it doesn't hurt.
What about abduction? How much is it
Abduction
now?
was 70.
70?
Yes.
So that was 70? Okay, let's see how far you can go. Okay, so abduction is 132. That was 70? That's good, almost double.
Wow.
External rotation, how much it was?
65.
65. Let's bring this back. Okay. And now, that was 65, now it's 82. Yeah, it's 80. 80 exactly. Okay. Internal rotation, how much it was?
50.
50. Internal rotation was 50. And now, by the way, when the number increases, that's a good sign, okay?
Yes,
Not the other
I'm,
way.
I'm figured that out. I did take math, so.
that was...
It's geometry, too.
Yeah. So how much it was the internal rotation?
50.
What about now? Oh, okay. Now is like 66. All right, so let's set up for me.
Wow.
I'm turning around this way. Okay, let's do the motion, this motion. How was that?
I can reach the back of my head.
Yeah, you
Nice.
did not reach
I
your
can comb my
hair.
hair back here. That would be
Yeah.
nice.
You know there's hair over there.
I've only been able to use a brush out here, you know.
Yeah, nice.
I
Oh
can
my
scratch your
God.
neck and all that.
Oh my gosh. I haven't ever, I don't remember when I could do that. My gosh.
Nice.
This is great.
Wow. Okay, so thumb up
Yes.
and do this.
Okay, you want me to stand up?
Doesn't matter.
Okay. Here. What do you want me to do?
Okay, bring up, up, up. Good. Yeah, that's much better.
That's better than it was.
Yeah, bring
Yeah.
it back.
Oh, this is,
Oh, look at that.
see, look, I can grab my elbows at the back.
Yeah, you could not do that before. Yeah.
No, I can reach in my back, but I couldn't
Yeah.
do that. That's
How
great.
is the pain?
Fine.
You feel
It's
better now?
Yeah, I'm excited.
Yeah.
I'm excited. Is this going to last, you think?
Well, based on the study we had, 87% had the long term.
Okay.
Yeah, based on the study.
Wow.
Yeah. So, what do you think about ASTR treatment? What you
I-
just had, like in a few minutes.
I never expected anything like this.
Yeah,
I mean,
yeah,
this is fabulous.
Yeah.
I'm so excited about my hair.
gosh,
I haven't got past that yet, but this is
Yeah.
great. No, this
Nice.
is great. Yeah, this is great. You know, when I first had the surgery,
Uh-huh.
I could only wipe my butt with my left hand. I couldn't reach back there with this hand.
Mm-hmm. Wow.
And so
After the surgery.
I had to have this surgery done second.
wow.
I did this one first so I could, after the surgery, I could reach back that far. But I could never do anything like
You can
this.
never do since the surgery.
This is
That
great.
was like in 2007.
2007 and 8.
2000. So 10
Yeah.
years you could not do that motion.
2000. Yeah, that's right.
For
No.
10 years.
No, I've never
Yeah.
been
How
able
many
to do
how many
that.
minutes we had here?
Even the physical therapy,
Yes.
I never had anything that did this. This is
Beautiful.
wonderful.
Yeah.
This is
That's
wonderful.
good. Awesome. I'm
Yeah.
glad that you're doing better. Thank you so much.
That's great.
Yeah,
Thank you for
thank
your
you.
help. That's wonderful.
Thank you.
I'm just happy. I'm very happy. Thank you very much.
Awesome.
Oh my God.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video with the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.